We're going to move to Marc Cloutier, who is the CEO of Caminar, another wonderful provider of mental health services. And you are on mute, Marc.
Thank you. Thanks for catching that I was on mute. Thanks to everyone who's on the call and to Georgia for organizing this. I would just want to start out with some general observations that I think the plan seems very comprehensive and has great stakeholder outreach and base. It shows great possibilities for collaboration. Some areas, there's one area that I think is missing a little bit, and we know from the behavioral and medical health literature that when people face quarantine, it's often a year delay in the most serious symptoms showing up. So what happens is that people are in quarantine, it eases, they return back to normal life, and then they have symptoms that they experience during the quarantine that will not go away, and that takes about a year to show up. So I think we need to be thinking about the demand for mental health services in particular is going to continue to go up, and there may be a very steep increase in March of 2021. I would add there's one piece that may be missing too, which is a population-based mental health promotion strategy. I think a lot of the services in a good way are focused on providing care services to individuals and perhaps institutions. But I think we need to think at a population level, what do we need to do to be promoting the overall mental health of the community that we could do through institutions or social marketing or other ways of getting at total population impact. Then I just want to say, I know this is written in the plan. I appreciate the focus on equity, but I really want to sharpen that. And I wish I had a time to throw up the graphic, but for many of you, I assume, who've done equity work, there's the comparison of equity and equality, and it's people trying to look over a fence. And equality has that there are people of different heights, and they all get the same size ladder to stand on, but only the tallest people can see over. Equity, of course, is giving people different ladders based on their height so that everyone can see over. So using that as a metaphor, I want to ask that we think about directing all priorities of resources and attention first to communities of color and to low-income communities. And I say that because we went through a recovery in the last economic downturn, and the effect of that recovery was to make, of course, wealthier people wealthier and low-income people poorer. And I think this moment of social justice and understanding structural racism reminds us that we need to put moving assets, moving decision-making, moving power, moving capital and social capital and infrastructure first to communities of color. So let's not think of equity as a collateral value, but as a principle we want to prioritize. Let's put it first, and let's put it up front. So an example of that would be when we're allocating resources for, let's start first by allocating required resources to communities of color or communities that are experiencing poverty. So for instance, around COVID-19 prevention resources, to prevent new infections and then to get better focus on earlier intervention. We know that in communities of color that there's higher infection rates. We also know that people have a more severe and earlier progression to disease. So we want the resources to go first to those communities. And this by prioritizing the resources first, the image that I have, kind of like the standing on the ladders, is that each community has a bucket that it's able to receive resources in, and there's a sequence to those buckets. Let's fill the buckets to the top in communities of color and low-income communities. So with that, I want to thank you all again for the ambitiousness of this plan. And as a county mental health provider that also provides housing support, education support, and job training, we look forward to collaborating with everyone on the success of this plan.